I was going to agree aggressively with that. The one other piece that I would add to it is much, much more aggressive and transparent view of performance about what's actually going on in the system and the incentive to do something about that. We actually know what works in most places. It's just the distribution of that performance is 10x in terms of variability about what it should be. And trying to make sure that people know what they're getting, what they're paying for, that institutions. There's a great cover story, if you haven't seen it, in the New York Times Magazine this weekend about Intermountain Healthcare and what they've been doing about trying to really understand and drive performance improvement within an existing system. And our best systems know how to do that. And it ought to be something that is aligned and incented with what patients want, which it is. And with much more transparency and incentive around that, I have much more confidence that our system can improve its cost and bend its curve much more rapidly than people think if that alignment is there.
I know we're staying on this question a little bit longer than I had anticipated, but on the basis of everything that each of you has said, it raises the question of the costs demonstrated within a region for one service. Who would do what Safeway, for instance, is doing for its members or for its employees so that they know what they're paying for and how to make a choice? I mean, we are blind in that supermarket right now. Which entity would do it? Would it be the government? Would it be the insurer? Would it be the employer? Would it be the system, the healthcare, the health system?
I would say it's going to be a multiplicity of what you just said. I think there is a role for government, and I think that government can help in terms of what I'll use a wide term, public reporting in comparisons. There are foundations. There are research groups like the Kaiser Foundation. There are some corporations that have that capability. I think the issue, in addition to the who, is the standardization and the credibility of the data. So I think if we can standardize that and get certain data points that regardless of who it is, because I think it's going to have to be more than one source, I think we can get at that.
So in the shift from pay for service to pay for performance, we see that we need technology, behavioral incentives, standardization, and more transparency, and also the integration of care a little bit better. Well, now, that brings me to you, Mr. Adams. How is the reform, at least the first steps in reform that we're seeing now, going to affect Kaiser's HMOs?
Well, we have spent considerable time, effort, money, positioning our organization so that we really are able to utilize and leverage technology the way that we were talking about earlier. So I think that from kind of transitioning to a place where we really are competing based upon quality, competing based upon outcome, that we are positioned well to do that. I think for all of us, the other thing is, I mean, obviously if we're able in a thoughtful and way to cover, the uninsured, more people, then obviously we will certainly benefit by more people being covered. I do think that the example that Ken gave of cost shifting, which we don't talk a lot about, but cost shifting in terms of what it does to the cost of health care for employers is huge. So I think the opportunity for us to create more of a level playing field in terms of organizations not having to carry that cost, not only should we be able to return that back to the employers and individuals in terms of their premium costs, but also, I mean, it actually frees up dollars to be used to kind of continue to reinvest in the organization.
Which then brings me to this question, and I think Mr. Mendonca and whoever wants to jump in, please do. What's going to happen to employer plans then? We've heard one suggestion that they'll just dry up and blow away because the U.S. Post Office, which delivers mail to Missoula, Montana, simply can't compete with UPS. My question is, will that happen?
Will employers drop out of the healthcare system?
Yeah, will
No,
the employer
so.
base die?
I think if the reform is designed properly, employers can still choose to compete in the war for talent by adding on benefits and not having it be cross-subsidized by tax benefit or by saying that we're going to have to pay on top of what we would do an extra $150 billion or more a year than every other industrialized country for lesser quality care. So there's no reason that employers should actually not be scared about reform. They should be engaged in reform because they're paying for it. So trying to get involved with a reform that actually moves the needle and allows you to spend the money that you want to spend on things that are valuable as opposed to paying for something that you're not getting value out of ought to be high on all employers' list.
Yeah, and I would just say ditto, and also add that you know, having been at the table and assessing and with Lenny and others, keeping the pulse on what's happening legislatively. The government, certainly the Obama administration, recognizes the risk that if the employer system was to collapse, I would tell you, we think it's bad now. I think somebody said it in their opening comments. We haven't seen anything yet. The system would collapse. So I think you will see anecdotes, you will see provisions that won't let that happen because it can't happen. It represents too much of the stability of even the system that we all criticize. So that is not my worry. My worry is how whether it's an option or it's an exchange or whatever, how it's constructed to make sure that it doesn't compromise the employer-based systems, and creates an environment where we have some equality in terms of services available.
Now, where does that, I think this is critical. Small business employs about half of all working Americans in the United States. Mm-hmm. And we see that some large number of small businesses, at least in the House plan, I think if you have fewer than 50 employees, you're exempt from participating, and we've seen some pushback on that. Where do small business and big businesses differ on reform and under reform?
I don't think there's significant conflict. The difficulty with small business, of course, is the cost of health benefit premiums. And larger company, larger aggregation of capital and resources, they're capable of managing that benefit more. The smaller the company, smaller revenues, it's much more difficult. The issue for small business is, can you, in a reform environment, create a benefit product that's affordable and provides quality benefits of a sufficient scope and breadth to make a meaningful difference for their employees.